Good morning. Thank you for tuning in to Voice of Reason Boston. Today we have Elizabeth Conward. She is the founder of Personal Intervention. Elizabeth is a licensed independent clinical social worker. This morning, Elizabeth will be providing some information and resources about mental health and therapeutic approach when dealing with clients. Good morning, Elizabeth. How are you?
Good morning, Tanisha, and thank you for having me here today.
No problem. Can you just give us a little background about what you do and what is personalized intervention?
Okay, so I have a master's degree in social work, and I have been in the social work field for about 14 years now. And currently I run my private practice, Personalized Interventions, and I primarily located in the Dorchester Hyde Park area. And I provide services to families, children, adults, all the way to elderly. And my background, I work with a lot of children and families through different agencies throughout the Boston community, providing in-home services primarily, doing in-home therapy and working with families and shelters. And one time I was a geriatric social worker working with the elderly as well. So I've pretty much worked with all age range.
Oh, that's wonderful. Where have you worked in the past?
I've worked with the Home for Little Wanderers. I've also worked with Catholic Charities and Ethos, which is an elderly agency providing services and case management for the elders.
What decision did you make to start personalized intervention? Why did you decide that, okay, I need to have my own personal practice? What were the needs that you saw that weren't being met and you wanted to just start your own practice?
At the time when I started Personalized Interventions, it was probably about a year and a half after I've gotten my independent license. It's something I've always wanted to do, is having my own business. I went and studied my own practice because one of the things that I hear a lot is there are not a lot of therapists of color out there, or specifically Haitian background therapists that's also Christian. And I think that at some point I wanted to start something where I can serve the population that I'm passionate about, and not work for an agency where it's kind of like I have to follow certain rules, certain expectation as to what service I can provide and how I can provide the service. But and which is why the name of my business is Personalized Interventions. I wanted to make it very personal, like personalize every treatment plan, every goals, every client that I work with. I wanted to feel like they are being treated as an individual, and it's all about them at the time. And basically, like, I want my services to be personalized per each individual.
For each person.
Exactly.
Okay. And what kind of services do you provide in your own practice?
Currently, I provide individual counseling for children, youth, and adults. And I also provide couples therapy, which is actually one of my favorite therapy to do. And then I do group counseling as well, and family counseling.
And I was looking over, your practice, and can you explain to our audience what is psychotherapy?
Psychotherapy is basically the term for counseling therapy. It's when you go and sit with a therapist, whether the person can hold a license in mental health counseling, or a psychologist, or in my case, a social worker that is licensed to provide therapy. And basically sitting with someone and talking to them about your issues, concerns, and things that you're going through. And I think a lot of time people believe that for them to see a therapist or to receive psychotherapy, they have to be going through some serious mental illness. And I always say to my friends, family, and people I interact with, counseling is not necessarily something that you seek out when you're going through something or when you have a mental illness. It should be something that you experience, that you do regularly as a checkup. Having someone to just talk to about, your dreams, goals, things that's going through your life. We all go through changes in our lives and have to adjust to different things on a regular basis. And they can cause some stress.
Right.
And if you're dealing with some regular daily life stressors, it's okay to see a therapist.
Okay. Yeah, a lot of people, I think they're afraid to be judged, or something's wrong, or they're crazy. No, there's a lot of negative things that are associated with people going to see someone or a specialist when they're going through something. And oftentimes, I think that people don't talk about it enough, as far as letting people know, whether it's in schools, jobs, that it's okay to speak to someone. Whether you're not going through something significant, it is okay to speak to someone, because it may trigger something down the line if you don't speak to someone at that time you feel that you need to.
Exactly. But like you said, some people still have a hard time seeking out help. And, you know, we still have a major stigma about mental illness and seeing a therapist and things like that. Especially in the Black community, in the Haitian community, it's not something that we talk about.
Right.
So it's really hard for people to reach out.
I always say, mental illness is silent, because you don't know what the person is going through unless you really sit down and have a one-on-one conversation with them. And it's funny that you have individual counseling. Can you tell us a little bit about what it entails when is it one-on-one, or do you follow up with people? For our audience that are listening out there, if you can just give a little bit description on your individual or counseling and family therapy, what each entails.
Okay, so individual counseling is usually about a 50 minutes to 60-minute session with a therapist.
Okay.
And the purpose of therapy overall is to identify certain goals that you want to work on. And basically your therapist's role is to guide and support you in accomplishing those goals.
Right.
And I always say it's up to you, the patient, the client, the individual, to decide what are the areas in my life right now that I need the support and that I'm struggling with. And that could be anything from, I just lost my job, I'm going through a divorce, I'm just stressed about my bills, my children are driving me crazy,
Right.
and I need somewhere where I could basically just vent and talk about these things, and someone could help me and teach me some coping skills on how to deal with these situations and the stressors that I'm dealing with.
Okay.
And that's basically the whole thing of individual counseling, is identify those stressors and identify, if sometimes it could be something more serious. Like a lot of people are walking around with serious trauma history, and they're not dealing with it.
Right.
And sometimes they don't even know they're dealing with it. They
Right.
don't even know that they have PTSD, which is post-traumatic
Stress disorder. And it's funny that you said that, because our last segment, last Saturday, we had the program director for trauma and response from the Boston Public Health Commission, and he said one of the things that people don't take advantage of is going to therapy and dealing with the trauma, being able to being able to speak to someone to help them deal with the kind of trauma that they're going to, so that it does not create something that is that gets difficult for them in the longer run. Go ahead.
And I think part of that is because a lot of times when we think about trauma, people think about major things like, something like domestic violence, child abuse,
right.
being physically or sexually abused, and things like that. And I'm just like trying to educate my clients and everyone that trauma doesn't have to be like a major thing. It could just be you were sitting at your house, there was a shooting
Right.
on the street and you got traumatized, or you driving or walking and got into an accident and now you're traumatized. It could be very simple things, and these little traumatic experiences, which really are not little, we don't see how they affect our body
Right.
and our minds, and we continue to go into work, school, and doing the regular things and wondering, hey, what's wrong with me? Something is not right, because we're not understanding that was actually a traumatic experience and something that maybe I need to reach out and seek out some help.
Right. And couples counseling, that's the biggest one.
Well, it's my favorite.
Okay. Couple counseling, we have a lot of people that are in a relationship, and oftentimes when couples are going through something, they usually call their mom, their dad, families, or best friend. What would you say about that?
So let me start with what you just said about calling your mom, your dad, best friend. Have you ever had a situation where you're angry about something and something is bothering you, call a friend and vent?
Yes.
And then by the time you get off the phone, you're like, what did I call them? Because all they did was tell you what you did wrong or what you should have done to fix it. And they give you all this advice and you're like, I didn't want an advice. I just wanted someone to listen to me.
Exactly.
And I always tell people in my life, friends, family, my patients, that is what therapy is. Having that person whose role was just to listen. Listen and help you process your feelings and help you understand what you're going through without the judgment.
Right.
Without the, well, this is what you should do. You know, but allowing you to process it at your own speed and allowing you to figure out, okay, what are other options I have? And giving you proper
advice,
tools and not advice, because therapists shouldn't be giving advice really, but more so the proper skills and proper steps that you can take to assist with it.
Right. I think the one thing that is good as well is that you have a third party that's listening in, doesn't know you from a hole in a wall, doesn't know your partner, so that person is not able to side for one person and leave you in the dark. Oftentimes when you call a mother, you tell your mother something, like my mom, if I tell her something, she will side with me. And that would cause
sometimes
friction.
The opposite is you're the problem.
Right, exactly. So I think it's really good for couples who are listening in to seek, if they need someone to talk to, seek a therapist.
I definitely seek a therapist if you're going through issues in your marriage, or if it's just like, you're in a relationship. Talk about it. A lot of time I feel like relationships end or marriage end because communication is like a big issue in relationships. People don't know how to properly communicate or express their feelings and thoughts without anger. Or sometimes they say something out of anger and they say mean things, but then there's other ways they could have expressed the same feelings but in a more productive way. And I think that's the one main thing I try to teach in couples counseling is communication skills, healthy ways to communicate your needs and seeing how can that better the relationship overall. And something I also push a lot when it comes to couples is premarital counseling. That's something I also do in my practice, is having the conversation of what to expect after the big wedding, because a lot of time couples focus on the wedding, but then once the marriage, after that day, it's never easy.
Exactly. After the door is closed, it's a whole different ball game.
Exactly. When the party's over, a lot of problems comes through with marriage. So I've always pushed premarital counseling to couples that I work with.
That's wonderful. And lastly, family therapy. What does that entail? Is that like parents and children together, or how does that work?
Yes, family therapy could basically encompass the whole family, and that doesn't usually mean only the people that lives in the house. It's the people that is affected by whatever the reason they need the therapy. So it could be a family that lost someone, a loved one, and they need counseling to deal with it. Or a lot of times there's a member in the family that's dealing with mental illness, and the family don't know how to process that, how to deal with that. Then we could provide family counseling as to giving everyone within the family different coping skills that they could use and deal regarding that individual in the family that's dealing with a mental illness. Also educating the family about what is that person going through, what are the symptoms they need to look for, what are the what can be helpful, what kind of coping skill that they can teach that person, like and use with that person, and tools and things like that. Things to help sustain the family, basically. A lot of my family counseling comes around children. A lot of time there are children that's acting out, having behavioral issues, and parents are like, I don't know what else to do. So I would do a lot of family counseling as to giving parents tools such as how to set limits, how to organize the home in a way that will be productive for that child. Also behavioral management skills, supporting in those areas.
I think sometimes it is, for me, I make it a point when I see my son to sit down and talk to him and ask him, how are you doing in school? What did you do today? Even though it doesn't make sense, but I feel like it's very important for parents to have a dialogue with their children just to see what they're thinking, pick their brains, because these children, they go to school, they interact with other children, and they pick up other kinds of behaviors, and they pick up every kind of little things that they can pick from one of their peers. And it's very important to have an understanding as far as what this child is thinking, what is it that they're watching, and it really stems on, you know, how you communicate with them at the end of the day.
And that's very important. And again, comes back to the communication. Communication is like key for everything. I think you're right. It definitely doesn't matter how old a child is. Once they get to that age, they can communicate. Definitely having that check-in of how was your day, how are you doing. I would say children are little people. You know, they have a mind of their own. They think things and they have questions, and it's okay to have conversations and asking your child, how was your day? What was great about today? Or what was the worst part of your day? And having those conversations, and also seeking help for your child. If you feel like there's a change in my kid, or for some reason my kid is acting out and I don't know why, or you know, you had a happy bubbly child 1 month and the next you're like, what's going on? This kid is sad or very antisocial all of a sudden. Seek out help.
Yeah. One thing that comes to mind when you're saying that is when the shooting happened in Broward County, Florida, and it was all over the news, and then I was home and then I was watching it, I thought my son wasn't paying attention. And you know, the next day came and we're getting ready to I was getting him ready for school. And he was like, Mommy, I'm sad. I'm like, why are you sad? It's like, those kids passed away. They got shot. And I'm like, okay, I need to do something. I need to reach out to his school and find out if there's counselors that can talk, because some parents are aware of what their children knows, and some parents keep them away from certain news like that. And I think it's very important to guard your children, but at the same time, when you think they're not listening, they are very listening in to everything they're tuning into everything around them. So when I called the school, which his school is very great, they had a counselor available to talk. He's only in the 2nd grade. And he was like, I'm very sad, and, you know, for these students. And, you know, I reached out to the school. They were very welcoming as far as my suggestions. They spoke to him. And when he came home, I'm like, so how do you feel today? He was like, I'm feeling good. Are you happy? And I was like, did you speak to someone in your school about what was going on? And he was able to speak to me and tell me that, you know, I'm much better, and what happened was very sad. But I had to tell him that your job is to be a child. Your job is for me to take care of you, and your father's to keep you safe. And I think that dialogue that we had made him feel much better, and especially the school coming in. It was very great.
And I think you handled that very well. Having the conversation with him, bringing the school into the conversation as well, and making him feel like, you know, your feeling matters, and that you understand that he knows what's going on, and talking to him. And that's a great way of building that relationship with him as he gets older, is communication. And I think that's one of the things a lot of parents lack sometimes, is understand that your child has, you know, the questions and things, and it's okay to answer those questions, obviously to their level. You're not gonna go and explain something that is just gonna confuse them more. But it's okay to have those conversations. And like you said, children are listening, and a lot of times we think we're protecting them, or
by not saying
anything, but they're hearing it in school, on the school bus. Their peers are talking about it. And I would say the best place for your child to get information is at home. Because then you can tell them the truth the way you want to tell them the truth, and versus someone telling them something else that may not be truth or fact, or something you don't feel like your child needs to know at that time. You know,
and kids are growing very, very fast now these days, and it is very important for parents, because I know when I was growing up, you know, in the Haitian household, parents really don't talk about it. You learn most of these things in school from other children. So I think it's very important. And that's one thing I had said to myself, as a parent, there's different approaches that I will take on for my child, so that I won't learn certain things as I did when I was growing up on my own, but for me to take it the next step for me to like teach them and make sure that whatever you hear comes from your mom and dad, not from someone else.
Exactly. And that's definitely part of, counseling as well. A lot of times I will have parents that comes for therapy because they're struggling with their role as a parent and setting limits and being able to set proper ways of disciplining their child or being overwhelmed, period, about the role of being a parent. It's not easy to be a parent.
And I always say there is no manual to be a parent.
Exactly.
It's as you go, you will learn. And you'll know you're doing a good job.
Exactly. And that's one of the things in individual counseling that I do work with families and parents about is their role as a parent and how to manage that role.
Okay. Right now, we're going to take a brief break, and then we'll come back and discuss more about your personalized interventions. Thank you for tuning in to Voice of Reason Boston, and we have Elizabeth Conrad. She is the founder of Personalized Intervention, and we will be continuing about our conversation about now mental health. What is mental health?
So the best way I personally would define mental health is this. When you are, every year we go and check with our doctors for our physical health, right? And our physical health is basically checking you head to toe, making sure you have no medical conditions or anything like that. Mental health is that same idea, but for your mind, to make sure that you're sound, with your mind and thoughts, feelings, and processing the way you process things, whether it's a healthy way and whether or not emotionally you are healthy and stable. That is all mental health.
Okay. Can mental health be detected?
Yes, definitely. I don't think everyone can detect mental health, but I think a lot of time, especially in ourselves, we usually know when something's wrong.
Okay.
It's like if you have a headache ongoing regularly, and you go into the doctors and they can't tell what's going on or why you're having this headache. And I'll tell people, well, sometimes it could be stress, and stress is a major sign of mental illness, because stress will then bring other things that could affect you physically as well as mentally.
Okay.
And dealing with a lot of stress in your life can eventually bring you to the point where you're now dealing with depression, especially if you don't have the appropriate resources, a person to help guide you in getting the appropriate services or tools needed to help with your stress, and you're dealing with it by yourself. Okay. Mental health can definitely be detected when seen by the right person. There are some mental illnesses that can be detected easier than others. Okay. There are people suffering with depression and you would never know. Okay, it's based on how we act and the symptoms that we're dealing with. A lot of people in our society are walking around with depression, anxiety.
Are all those linked to mental health?
Those are all mental illnesses,
okay.
Yes.
Okay.
And I think when they dealing with things like depression, anxiety, even sometimes PTSD, if you don't sit with that person, they explain you their symptoms, you may never know. Okay. And sometimes, a lot of time, people ignore their symptoms. So then it wouldn't be detected. But there are more intense mental illnesses where you would just know something is not right.
Okay. When someone comes to you, like your clients come to you with mental health illnesses or with any other kinds of disorder that would be linked to mental health, what do you do?
It varies.
Okay.
Like I mentioned before, there are a lot of different mental illnesses. Mental health is basically saying how healthy are you mentally, versus, or what type of mental illnesses you're dealing with. And part of personalized interventions is my interventions with each client is based on what are the mental illnesses, what their needs are, what they're dealing with. If it's if it's someone that's dealing with depression versus someone that's dealing with PTSD, is going to look completely different. The type of treatment plan that we have and how we work together, and the coping skills that I may be working with them and teaching them how to use those coping skills in what area. Same thing with someone that's dealing with anxiety. It's okay, when is it that you feel the most anxious?
Okay.
You know, what are the triggers to your anxiety? Identifying triggers.
Okay.
You know, we all have triggers to different things. Some of us, being in social environment could be a trigger for us, you know, for our anxiety. Then it's like, okay, so what are the tools? What are the things that you can do when you are in a social environment to minimize those anxiety symptoms that you feel?
Now, if it's not treated, what could possibly happen?
Again, it depends on the type of illness that you're dealing with. One of the major mental illness that I deal with my clients are PTSD, depression, anxiety, and bipolar. Now, bipolar going untreated for a very long period of time can at some point will cause some issues if the person ends up going through some type of episode. Okay. And also there's bipolar type 1, there's bipolar 2, depends on the type of bipolar the person is dealing with, if it's gone untreated. And a lot of time with my bipolar patient, they go through the self-medication route.
Okay.
And that could only work for so long. So it's counseling, making sure you see a psychiatrist, seeing if there's any medication that can help you with that type of mental illness. And not every single mental illness require medications, but there are some that medication is a necessity. And I have worked with patients who are bipolar where medication is not necessary. They have gotten to a point where they have enough coping skills and know how to deal with their diagnosis and can tell, okay, when they are too stressed and certain things going on and how it's going to affect them, and they can control it in that sense. And then there are other ones is they need to be on their medication regularly to maintain good mental health.
Right.
So again, it varies on the type of illness that you're dealing with.
All right, I think that's very important because I think at least 99% of the time everyone has probably had a mental health episode in their life, depending on, you know, what their life is what's going on in their life, excuse me. And I think it's we have so many things in front of us. We have life, we have social media, and we get very overwhelmed with the things that we see, and then what our own personal issues, and we try to mask it in many different ways. And this week we had two tragedies, one from Kate Spade and the other from Anthony Bourbon. And you see these people making of millions of dollars, and you think they can get the help that they need at any given time. But it's different, you know. We only see the outer appearance. We don't know what's going within, and it's very sad to see that in the society that we're in today, people are still taking their lives because they don't feel that people are listening to them, and you know, they want to put a persona to make other people happy, but inside they're not happy. And it is really a tragedy because they made a wonderful impact in our society. Kate Spade was one of the first designers that I brought her purse when I was in college. And Anthony Bourbon, I'm such a foodie person. I always watch his shows, traveling, eating, and I've always used to say, I would love to have that job. Love to have that job. Just sit and travel and eat. That's the best job. He has the best job. He has money, but it's really not about that. And people get caught up with money and situation, but deep down inside, people need to understand that money is not happiness.
Definitely, money is not happiness. And a lot of times, what you said, people are hurting inside and they're not talking about it. And I always say, a lot of times people that unfortunately ends up committing suicide, they don't broadcast you know, that this is what I'm going to do. Or a lot of times they keep those feelings inside, and when it happens, it's a shock. It's like, oh, a lot of times you hear people say, I'll never think he or she would do that.
Right, because they're afraid of being judged. That's the judgment part.
Or not seeking proper help or talking about it. And suicide is one of those topics that is always hard and difficult because a lot of people don't understand the turmoil these people are dealing with and going through, and it could be a lot of things. A lot of times we hear young people committing suicide due to bullying or cyberbullying, and that's definitely part of it. But there are others, it's just they get to the point where it's like, life is too hard for me and I can't deal anymore.
No one understands.
No one understands what I'm going through. I just can't go on. And they don't really know how to express that or how to change that fact. And a lot of times you don't know how long this person has been contemplating it. It could be, you know, I've been having these ideations forever now and I never speak about it. And then one day I act upon it. And there's, especially when it comes to adolescents and kids, a lot of times you will see signs. They'll like cry in different ways and there are different actions.
They'll seek attention in different ways
in different ways. And I say to parents, pay attention to those. You know, when your child is acting, what we call acting out, but it's usually saying, hey, I need help. It's a cry for help. As for adults, a lot of times they don't talk about it.
No.
You know, it just happens.
Especially men, they have that masculinity. You know, they're strong. They're the ones that you should be crying to their shoulders, and you know, and it's, they have the same problems we do.
Definitely. And I think, especially in our society, if you're talking about men, mental health, a lot of the men, especially Black African American men in our community, are dealing with depression and anxiety. But getting one to admit that, it's very hard.
Yeah.
And when they do admit it, and then you say, okay, well, maybe you should seek counseling. It's like, oh, no, I don't do that. And I think that's definitely part of the education that needs to be done in our community, that men, women, whatever, it's good to have someone to be able to speak to and share your feelings, thoughts, concerns, and fears, and being able to see, okay, who can help me process and deal with these feelings.
And the thing is, the first time I heard about suicide is when I was in high school. I was a medical student out in Dover, Sherborne, and I was in ninth grade. First time going to an outer high school, going to the suburban area school, and I heard of suicide, and I'm like, what's suicide? What's going on? I saw some kids crying, some of the kids crying. I'm like, what's going on? And then one of the kids that committed suicide, I actually, you know, interacted with, and I'm like, and I was a little bit confused. I didn't understand why, you know, why is this happening? And then it became a domino effect. Every year you would hear at least 1 or 2 students committing suicide. And I really didn't wrap my head around it because I didn't understand it. I didn't hear any, there wasn't that many counseling for the students at the time I was there. It was just something that really wasn't talked about. It was silent. And I think it is very important that we need to engage in more conversations in schools, in our communities, where this is getting too common, and it's not okay to commit suicide. You know, I encourage everyone who is in their lowest estate due to anything that's going on in their life to seek, you know, treatment. You know, reach out to your doctor and find out what kind of resources, or look into your community. Today we have personalized intervention. One of your resources that you can go to within, you said Boston and Hyde Park area, that you can go and seek some help. It's okay to talk to someone. It's okay to ask someone to hear you out. You don't have to go to a family member, because there's other people out there that is willing to listen to you without any judgment.
And I want to say, it is easier said than done to say to someone, seek help. Because if someone is dealing with major depression or really thinking about suicide, they most times of not thinking about seeking help. If they've already made the decision, like that's what I'm going to do, the chances of them picking up the phone and saying, "Hey, I need help," are are not likely. Versus the person that's okay, I'm thinking about this and I know I shouldn't be thinking about this and I know I don't want to hurt myself, I don't want to go through this, they're more likely to ask and seek for help. So what I suggest is reach out to your friends and your family and people and ask the question. And it's okay to just call and check in to everyone, all your people in your life, the ones that you feel like something is not right, the one that's isolating themselves that you don't see around at family social activities often, and the ones that when you're around them that just seems like this person doesn't seem happy to me, or there's been a change on their personalities and their behaviors, something's off. And even I've been on Facebook a lot since these incidents happened, the 2 suicides that recently happened, and there's been so many posts about them, and one of the posts that I read was your strong friend, check on them. Right. The one that acts like the superwoman and that's doing everything and that's always there for everybody, check on them. Because just because in the outside they look like, oh, I'm happy, I'm financially stable and everything is great, doesn't mean that they're not dealing with their own personal issues. And that's all we as friends, family, and loved ones can do, is calling someone sometimes and just say, hey, I'm just checking up on you and see how you're doing. I'm here. Or do you need me to help you find some resources? And just checking in.
And I think another thing is true is that a lot of people are afraid, telling people what they're going through because they're afraid that, they'll spread their business or they'll go around and be malicious, because we're in and we see everything around us. You have people who things are being leaked on social media, and the last thing someone wants to go through is being able to be sincere and share their thoughts with someone, and then all of a sudden it's all over social media.
And that is something none of us can prevent from happening, because sometimes we trust people and we share things with them thinking it is going to be between me and that person, and it's not.
Right.
And that's where seeking therapy helps, because your therapist can't share your personal business.
Exactly.
So if you are going through something where you feel like I really need to talk to someone and you don't know who to trust about it, seek counseling. Have that person I could talk to, and knowing that it is confidential. And yes, psychotherapy is 100% confidential between you and your therapist. So you don't have to worry about it getting out.
Okay. And as a Haitian woman, and we know that's big in our Haitian community, do you think the Haitian community is receptive to mental health?
I think as a community, we are doing better.
Okay.
I have received more referrals for Haitian families or Haitian youths, even, older Haitian men and women. So I think we're doing better. I think we still need to work on it. I think there's still a lot of education that needs to be done around counseling within the Haitian community. And it's funny you mentioned, as a Haitian woman, and we were talking previously about people worrying about their business getting out there. Exactly. And I think there's this thing stigma. When I get a Haitian client, it's like, who you related to? Do you know anybody that I know? And I'm just like, it doesn't matter if I did, because I can't tell anyone what we talk about in our sessions. And educating them about that. And I think there's always that fear, especially if the person doesn't speak English. Like, do I really want to go to a Haitian therapist? Because then I don't know who they know that I may know. And
the Haitian community is very small.
Exactly. Our community is small. And you never know who they know and who you might run into. So then they scared to go talk to someone about that. And I always say to them, like, when you come in that office and you see me and you leave, no one knows you in my office unless you will go and tell them you were seeing me. And I think our community as a whole has a lot of education that needs to be done about mental health, domestic violence, and a lot of other important social justice topics.
Yeah, because I remember when I was working for the district attorney's office, and I had one mother crying to me. Her son had mental health, but she really didn't know what to do. So usually in district courts, they have court clinicians where they can section the child and, interview them and petition in court to have them be sent to like some kind of facility for their mental health. And it's sad that a lot of Haitian families really don't know what to do when it comes to a child or their loved one where, there's help and intervention out there for them. And I felt that something needs to be done. Something needs to be done, more education about mental health, because it's still rapid in the Haitian community. And, I know when I was growing up, mental health wasn't an issue. But if any one of my siblings had mental health, I don't think my parents would be equipped to know what to do. They'd probably say there's nothing wrong with you, you're just being unruly, you're not listening. And I feel like they need to be educated and know what the symptoms are and what to do, because they're so secretive. Haitian people are so secretive. They don't like to, talk about their business because they're afraid it's going to go this way, it's going to go that way, and someone's going to know. And then the whole gossip situation. So
I think as Haitian people, it's more that we're prideful than being secretive. We have so much pride as a culture that we want to look good in front
public.
Of our peers
Right.
in public, and that when certain things are disrupting our homes, like a child that's obviously dealing with some type of mental illness, the idea of putting that out and like, oh, people's gonna talk about my family,
Right.
and my child is making us look bad right now with all this, issues going on. They'll rather just keep it amongst the family,
Right.
versus seeking help for it. But like I said, I think I've seen a lot of progress in that area within the Haitian community, and we do have a lot of resources in Boston. I mean, I cannot speak for the state as a whole, and I cannot speak for the country as a whole, but I can definitely say for Boston, there are
Right.
a lot of resources. And resources where there are a lot of Haitian-speaking providers. It's a matter of finding the resources, of making the phone calls. And I tell clients all the time, call your insurance. Just call myself or Blue Cross or whatever insurance you have and say, hey, I need a clinician with these expertise, and they would refer you. They'll give you a list of who you can call for those services, and I'll say start there. And then the other thing is go online and research it. There are so many mental health clinics in the Boston area, serving different populations, like groups, cultural groups and things like that. Just do the research. The services are out there. Granted, we definitely need more. Many of them have really large waiting lists,
Right.
and I do know that is definitely an issue within the mental health providers that are out there. We have a lot of services, but not a lot of providers.
They're there, but they're not there.
Exactly.
Okay.
So it's but if people really look for the services, they can find them.
They can find them. And the only reason why I say Haitian, as Haitian women, we see these things. But there are other cultures in the city of Boston that may not believe in mental health too, and they're not seeking the help that they need. I know interacting while working in agencies in Boston, some of them just don't believe in the mental health, and they can do it on their own, or there's other ways that they can deal with it.
I think there's so many different level to that, especially when you're talking about the Haitian culture. Part of it is, in some cases, it might be I just don't believe in mental health
Right.
services. I don't believe in single therapists. Then there's that whole part of it too, as people's doing things to you.
Right.
Within the Haitian culture, there's this big part of someone that wants to hurt you, that's doing voodoo or something on you, and they see it more of that's the issue versus this person dealing with a mental illness.
Right.
And then there's when you go within the church as Christians, a lot of time is just pray about it, versus pray about it and get you help, the proper service and help that you need.
Right.
So I think depending on each individual's culture and how they grew up in their homes, the beliefs of their specific family beliefs and culture, as well as their religion, all that factor on why they would or would not reach out for services.
And speaking of churches, as a woman of faith, do you feel that churches are equipped to provide assistance to their congregation when it comes to mental health?
I think churches are doing the best they can based on the resources that they have. I'm aware of churches where their pastors are also licensed psychologists, licensed mental health clinicians.
Right.
So they can be your pastoral counseling as well as your mental health counselor, and be supportive in that sense. There are churches that have a lot of professionals in the field, in the mental health field, that could help and assist. And other churches have less resources. So I think I can't say as a whole within churches, but I do know personally in churches that I've attended, where I've personally been invited to various churches, will have conversation with their youths and members of the churches about mental illness and services that are out there for them.
Okay.
So I think there's, again, some progresses in some churches, and there are still churches and pastors whose belief is just pray about it.
Right. And I believe prayer is good. However, God also provides resources for us to use so that we can help others who may not be able to be deeply rooted in their faith to know that.
Exactly. And I always say, definitely pray about it, meditate, do whatever you need to do for your own spiritual well-being. Because, spirituality is so broad, and everyone has different ways of dealing with
Different beliefs,
different stress. So whatever that is for you, definitely do it. But with that, you should also find the proper professional help that you need to balance the two. Because, our spiritual life is very important. And to some people, even with counseling, they need that, spiritual aspect of it to know, like, I'm still praying, I'm still doing my Bible studies and doing all of that to help me with whatever the situation or issue I'm dealing with. But a therapist can help you with certain tools and coping skills and certain things that would also assist with whatever it is that you're dealing with.
Okay. And do you think there is enough awareness in schools, communities in the city of Boston to provide resources to educate about mental health?
I think we definitely need to work on the awareness. I do believe that there's a lot of resources. I don't think that people are aware of all the resources that are available to them, that's where the education piece needs to be done in the churches, the schools, and in the community. Like, where do you go when you need a therapist? Where do you go when your child is behaving a certain way at school or at home and you feel like they're out of control and you don't know what else to do? Where do you go for support with, depression, or you have someone in your family that's dealing with a loss or some type of trauma? Who do you call? I don't think people know where to go for these things.
And for our listeners who are tuning in now, what advice would you have for them?
I would say, if you are currently dealing with some type of mental illness, and that could be a range of a lot of things, and you feel that you're at the point where you can't handle the situation on your own anymore, you definitely need support. Seek out first to your insurance provider and see who can they refer to you for counseling. A lot of time I get a lot of referrals from EAPs to people's employers who would have EAPs. Seek out to the EAP to your employer if that's easier, and say, hey, I need a therapist, and these are the criteria I'm looking for. They would usually go out of their way and seek the clinician that meets your criteria. That is one of the fastest and easiest way I think someone can be linked to a clinician. Granted, you'll usually get a list and you'll have to call on your own. And I have received phone calls where it's like, oh, you're the 8th clinician I'm calling, and the other ones didn't call back, or the number is not working. It's going to happen, but don't give up. Go online, Google it in the area you live in. Hey, mental health clinics in my community, they will come up.
Okay. And do you have any events that's going on where people can check personalized intervention? If you can give them your website address and your social media.
Well, my website is www.personalizedinterventions.com, and that is personalized with ED, interventions with the S at the end. And also with the same name for Facebook, I have Personalized Interventions at Facebook. Those are the best two ways to reach me. And as for events coming up in the next few weeks, I'll be running a group for women about self-identity and identifying goals and bettering themselves and things like that. I will have the flyer on my Facebook and my website within the next couple of weeks.
Well, Elizabeth, thank you for coming in. It's always a pleasure to have you come back.
Thank you.